Every single day, hundreds of ambulances crisscross our roads, sirens blaring, racing against time to save lives. But here's a hard truth. Not every 995 call is a life-or-death situation. In fact, a large number of these calls could have been resolved without emergency help. So what happens when our ambulance system gets overwhelmed by non-urgent cases? Could that mean a delay for the person who really needs that ambulance? Well, starting the 1st of June, Singapore is taking a bold step to tackle this challenge. Introducing NurseFirst, a new nationwide triage helpline that might just change how we handle medical emergencies in this country. Here's what you need to know. NurseFirst is a collaboration between the Singapore Civil Defence Force, Woodlands Health, and supported by both the Ministry of Home Affairs and the Ministry of Health. It's designed as a medical triage service, meaning trained nurses, backed by emergency doctors, will assess your condition over the phone and guide you on the right steps to take. Let's break it down. Say you have a mild fever, a sprained ankle, a nosebleed, or even a small burn. Instead of calling 995 for an ambulance, which might end up blocking an ambulance that someone in critical condition really needs, you can now call NurseFirst directly at 6262 62 62. They'll advise whether you can see a GP, visit a nearby clinic, manage your symptoms at home, or if needed, they'll escalate your case for an ambulance. But here's something really interesting. Even if you call 995 and your case is deemed non-life-threatening, you may be transferred directly to NurseFirst. This means key information, your condition, details, symptoms, will be shared seamlessly, so you won't have to repeat everything. If your condition worsens during the call, SCDF will be immediately alerted, and an ambulance will be dispatched without delay. This service is free, operates island-wide, and is available daily from 8 a.m. to 11 p.m. Now, why does this matter so much? Because in 2024 alone, SCDF responded to 672 EMS calls a day, a 57% jump from 2014. That's massive. And as Singapore's population ages, these numbers are only expected to rise. If we don't start diverting non-urgent cases to the right channels, we risk clogging the system, potentially delaying help for those in critical condition. Countries like the UK, Japan, Denmark and Finland already have similar nurse-led triage systems, and they've seen results. The hope is that Singapore's NurseFirst can make a real impact in easing the pressure on ambulances and emergency departments. But here's where you come in. Will Singaporeans embrace this change? Will people actually call NurseFirst at 6262 6262 for non-urgent conditions, or will they still stick to 995 because it feels more immediate? Let's discuss. Do you think NurseFirst will succeed in reducing unnecessary ambulance calls? What kinds of public education will we need to make this a success? And are there any concerns you have about how this will work in practice? Drop your thoughts in the comments below. Do you think this is a step in the right direction? Or do we need more to address the strain on our healthcare system? And if you found this video helpful, remember to like, share and subscribe to 2230 for more deep dives into the issues that matter in Singapore.